Hello, and welcome to Complete Chiropractic Healthcare on the website of Dr. Greg Arnold, www.pitchingdoc.com. I'm going to give you a quick look at my homepage in case you want to go ahead and visit the website. So today's presentation is going to be about whiplash. And it's primarily for personal injury attorneys because it will get a little technical regarding some research and some science. But it's also just as good for patients so they can understand if they've been in a motor vehicle crash, why they're having pain. So we're going to go ahead and get into presentation mode. And a little bit about me. I've been in practice about 10 years, but I've been receiving training on whiplash from the Spine Research Institute of San Diego since 2003. And I've attended their standard course, their 4-part course, numerous times on whiplash. I've also attended their advanced course, which they give every November, that goes over that previous year's research. And in 2003, I attended a 3-day seminar at the Spine Research Institute of San Diego, where I witnessed human crash testing. So today we're going to be discussing whiplash statistics, the biomechanics, issues with delta V, the junk science that is used by insurance companies to justifying denying treatment and payment to those who are justifiably injured. We're going to talk about risk factors, why some people are more injured than others, the classifications of whiplash, treatment guidelines, the paperwork that we use in our office to help justify a patient's injuries and symptoms, why chiropractic is the preferred way to help treat whiplash problems, and why I can help patients and also personal injury attorneys with their clients' injuries. So when we look at whiplash in general, the most recent estimates classify it as costing $43 billion a year, but that's only based on 1.4 million motor vehicle crashes. It's actually thought to be closer to 3 million because, as I'm sure many of you know, many injuries, many motor vehicle crashes get unreported. So while the reported number is at 1.4 million, many people think it's at closer to 3. So we're going to discuss right now, despite all of the advances in car crash protection with vehicles, why is it that it seems that whiplash injuries are increasing? So we're going to look at some video in a minute, and it actually has to do with what they call the 5-star crash testing ratings. And you'll see there's a lot in commercials. A lot of car companies use it to justify the safety of their cars. And what the 5-star ratings are talking about is that the cars that are being developed now are being developed to keep people alive who are in high-speed vehicle crashes. But what has happened, the unintended side effect of all this is while the cars are actually softer at high speeds, and this allows for something called ride down, which helps dissipate the energy into the car and not into the occupants, the cars are actually becoming stiffer at lower speeds. And we're going to look at some video in a second. So when you see a car accident where the car actually has a lot of crash damage, that means that the car itself has absorbed the energy of the impact, which is why sometimes you can see people get into high-speed crashes and they actually walk away, sometimes with very few injuries or symptoms. And then as a result, because they're softer at high speeds, they actually become stiffer at low speeds. So because they're stiffer at low speeds, the energy doesn't get absorbed by the car, it actually gets absorbed by the occupant. And that's where you'll see people who get into car crashes at low speeds but seem to have symptoms for long periods of time, even in the absence of car damage. And this has to do with a little bit of science. So there's something called delta V, and the delta V is the change in velocity that occurs over the course of a car crash. And while it's usually hailed as the gold standard of the holy grail for accident crash reconstructionists, or ACRs, it's actually, the research shows it to not be as accurate as they portray it to be. But what in actuality is that it's actually all about the acceleration in the car crash and not the delta V. So this is the one little piece, this will be the one formula that we're going to talk about. When we look at acceleration equals the change in velocity over the change in time. Now, when I said when you're in a high-speed crash, it's actually the crash takes a longer time to occur because of the car damage, the ride down. And because of it's a longer duration crash, T is going to be higher. And if you look at the fraction, if you have a higher value for T, you're actually going to have a lower value for A, for acceleration. But when you have the low-speed crashes where the cars don't get deformed, they don't get damaged, therefore the duration of the crash is actually shorter, a lower value for T actually creates a higher acceleration, a higher value for A. So now we're going to go ahead and take a look at a high-speed crash. So if we look at this car crash test here, the closing velocity of the vehicle, the VC, was nearly 37 miles per hour. The delta V was 17.1. The acceleration of the occupant was 10.3. So as we see, we have a high-speed, long-duration crash, major property damage, and the acceleration experienced by the occupant was 10.3 Gs. So we're going to look at several different views here. Again, this is a high-speed crash, 37 miles an hour, a delta V of 17.1, head acceleration of 10.3. Now it's going to go into slow motion here, and you're going to see the amount of damage. When you look at the back of the car in the front, you see all that damage. That's what they call ride down, and that's actually what creates the longer duration, right? The longer duration of time creates the lower acceleration, okay? So now we're going to look at a low-speed crash where the vehicle closing speed was 7.8, which is 21% of the original of the high-speed crash. The delta V was actually 5.8 miles per hour, but the acceleration of the occupant was actually 23% higher than the high-speed crash. And again, if you look at it, very little to no damage to the car, and as a result, because there was no damage to the car, the duration of the crash is much less, and as a result the acceleration is much higher. And that's actually the best predictor of injury, is the acceleration to the occupant, not the delta V of the crash. So we're going to show you some research, and this is a very important study, probably one of the most important whiplash studies that has been done, and it's a study by Radonov in the journal Medicine from 1995, and one of the studies from one of the quotes from the studies is that the amount of damage to the automobile and the speed of the cars involved bear little relationship to the injury sustained by the cervical spine. So a lot of times insurance companies will do a no crash, no cash mantra, where if there's no car damage, then the occupant must not have been injured. But you saw from the video that car damage bears little resemblance to what can happen to the occupant. And now this is a quote from Dr. Croft from the Spine Research Institute, from a journal that an article he wrote in the journal Forum from 1987, where he says 80% of whiplash injuries occur at crash speeds below 12 miles per hour. Other studies have shown that the threshold of damage for many cars ranges, for many passengers in cars range from 8.5 to 12. So as a result, a large percentage of real injuries occur in the absence of significant vehicle damage. So there is no justification for no car damage justifying no injury. So a lot of times we'll see, and this is from Dr. Croft's latest textbook, Whiplash and Mild Traumatic Brain Injuries, that really is a must-have for any physician involved in personal injury or even personal injury attorneys for their practice. On page 11 of the textbook, they talk about where you'll have a car crash between two cars, and while one occupant seems to be uninjured, the other occupant seems to be significantly injured for a long period of time. And this has to do with risk factors, and we're going to get to those in a few minutes. So there is no threshold. This is very important in the defense. Defense will usually claim that a threshold for trauma exists, that you have to be going a certain speed in your car or you have to experience a certain delta V to be injured. And as we just looked at with the formula for acceleration, delta V really bears little resemblance to the predicting injury. So it's all about time versus acceleration. So when we talk about whiplash victims, and unfortunately with our society, a lot of people who are in car crashes are victimized for trying to fake it and to get settlements for not really being hurt. Now, there's an author, her name is Natalie Spearing, and we're going to actually visit quite a few studies done by her. These are two that she did in 2012 in the journal Pain and the Journal of Law and Medicine regarding financial incentive and symptoms. And she found out that removing the financial incentive has no effect on the self-reported neck pain for people who were in car crashes, and that there is no clear evidence to support the idea that compensation is related and its related processes lead to worse health. Now, there's something that she has talked about called reverse causality, and a lot of times people are viewed at that if they get into a car crash and they go seek the help of an attorney, that they're seeking the help of the attorney, and that's making them appear more injured. Or in actuality, it's that they're more injured. As a result, they're seeking the attorney. So she did 3 studies between 2011 and 2013, and of course I can provide you those studies upon request, where she talked about the assumption that claimants are worse off when represented by legal counsel has led insurers to discourage claimants from seeking attorneys. But the alternative should be viewed that patients who have a more severe problematic injury are more likely to engage with an attorney, and that's the reverse causality bias. And this was reviewed by Dr. Croft in the 2013 advanced proceedings. So we're going to review some studies that the defense will use to try to discredit the concept of whiplash. Many of them try to give the idea that whiplash is actually a fake phenomenon and that people don't actually suffer from whiplash. This is from 1994, a study by Allen, probably the most widely used paper, where they looked at everyday experiences such as getting slapped on the back or falling into a chair. And this study was refuted several years later by Dr. Croft and by Dr. Michael Freeman, where the whiplash accelerations, again, we're going back to the acceleration concept again, delta V over delta T, where it's about the time and the duration of the accident that predicts the acceleration. And they found that whiplash trauma produces a peak acceleration that is 150 times more than that of produced by plopping into a chair. We look at another study from 2000, New England Journal of Medicine. They talked about the issue of compensation for pain and suffering, and they concluded that when you take away the ability of people to sue for pain and suffering, but still allow medical care, they make fewer claims. And this was refuted several months later by Dr. Freeman, where he cited other research that there was no evidence supporting the conclusion that they had actually recovered. Because what I'm sure you realize is, well, what is the definition of recovery? Many people who wind up going back to work many times still have symptoms. They're still hurt, but because they're unable to get medical care, or they're maybe issues with work, they have to go back and start to make a living. So many people do go back to work injured. It doesn't mean that just because they've gone back to work that they're recovered from their injuries. This was the final study from the Lancet, 1986, that talked about late whiplash syndrome, and they looked at they looked at countries in Scandinavia, and they talked about that if in a country where no legal system exists for whiplash claims, that whiplash simply doesn't exist. And what the study was refuted, again, same year, several months later, by Dr. Freeman and Dr. Croft, that none of the previous studies' conclusions related to the natural progression of whiplash are valid. So we talked about long-term risk. When I speak with personal injury attorneys, they're always asking, well, is there research showing that chronicity of symptoms does exist? And we're going to go back to the at.of study that was done back in 1995, and they did a 2-year follow-up, and they looked at symptoms over 12 weeks, 6 months, 1 year, and 2 years. And even 2 years after a motor vehicle crash, 18% of patients. That's nearly 1 in 5. 1 in 5 patients who are in motor vehicle crashes have symptoms. So when we look at these statistics, how can we decide, well, what affects these outcomes? And what affects the outcomes are the risk factors of the patients involved. And these are all risk factors for whiplash. And the number one risk factor for having long-term injuries from a motor vehicle crash is being female, and that has to do with having less muscle to protect joints and ligaments and discs and nerves in the spinal canal, but also in other joints such as shoulders, hips, knees. But we also have issues with previous injury of neck problems. We also want to look at the head restraint. What position was the patient in? Was the patient belted? In the car, was the patient aware of the impact? What head was their position in? Did they brace for the impact? When they braced for the impact, did they hold onto the steering wheel? Did they slam on the brakes? So this is very important. When a patient goes to see a physician, the physician needs to obtain all this information, because it will play a big role in helping justify injuries to the occupant in the car crash. So after once we get a patient in the office and we look at them and we perform an exam, then we get to classify their injury. And there are currently 4 grades of whiplash as described by the Quebec Task Force back in 1995. But for people who are very familiar with whiplash, you will see that these are actually very similar to the guidelines that Dr. Croft designed right around the same time. So then we look at, well, once we have a patient classified, we do an exam, we dissect the details of their accident, of their car crash. What can they do? What treatment can they seek? And chiropractic is actually can be a very effective treatment for whiplash symptoms. And there's a study done in 1986 in the Journal of Injury that benefits can occur in 90% of patients who undergo chiropractic treatment for chronic whiplash injury. And the reason that is because chiropractic treats the joints as well as the muscles and the ligaments and the scar tissue. And if you can keep the joint healthy, you're going to be much better at improving patient symptoms and overall quality of life. So when we look at the protocol, we classify the patient according to their symptoms, and we go from 0, 1, 2, 3, or 4. And these guidelines are referred to as the Croft guidelines. And Dr. Croft assembled these guidelines on treatments based on 2,000 randomly selected cases. And this is the only accepted treatment guideline for whiplash, and they've been adopted by 12 states so far. But even the Insurance Research Council, they've stated that the average number of treatments rendered by chiropractors for a whiplash injury is 32. And if you look at 32, that is for a grade 2 whiplash injury, which is the most common. And obviously, if you get to grade 3, it's much higher, and then grade 4, definitely much higher. So when we get a patient in the office, how can we start to justify their pain and their symptoms and their complaints? Well, we have to do this based on paperwork, and there are several validated questionnaires and surveys that are done, and all patients who come into my office fill out these forms based on their presenting complaints, whether it's the Neck Disability Index, the Oswestry, the Rivermead, the Visual Analog Pain Scale, Life Satisfaction Survey, or the Whiplash Disability Questionnaire. Now, when we look at chiropractic's ability to treat whiplash effectively, this is actually from a whiplash report that I've created, and this was from 2014, Volume 1, Number 8, on a study that I reviewed by Dr. Croft. Not Dr. Croft did the study, but he reviewed the study, and I put it together in a newsletter. And in the Volume 1, it said strong evidence was found that spinal manipulation needs to be included in a multifaceted approach to treating whiplash with grade 3. And if you remember, grade 3 whiplash, that is less than 76 treatments. So grade whiplash disorders are significant injuries after a crash. Another report that I did, they showed that 9 weeks of chiropractic care freed 27% of patients from pain compared to 9.4 for acupuncture and 5% for traditional medicine, even though chiropractic patients had pain for nearly twice as long as those in the organized medicine group. And if you go to my website, you can go to my website and type and look up at the Whiplash banner. It will then push down this Whiplash link. You click on that, and it'll pull up the Whiplash report, and on the side you can see the Whiplash reports that goes over the latest research on whiplash biomechanics, imaging, and the best ways for people who are suffering from whiplash to get treated. So how we can help, in addition to all the paperwork, we use J-Tech muscle testing, range of motion, grip strength. We use vibration percussion therapy to deal with scar tissue, the Graston technique for scar tissue, kinesio tape to help with healing, and obviously prompt re-exams and narrative reports to help keep you up to date on the patients, on your clients. So, I know you want the best for your personal injury clients. I've been trained to help treat them. I hope a lot of what we talked about made sense, whether you're a personal injury attorney or you're a patient. Whiplash is something that is real. It's been validated by science. Just because you've been in a car crash and you have no damage to your car, don't let that make you think that you're not going to get hurt. So I hope you found this information valuable. Again, you can go to my website at www.pitchingdoc.com, and you can send me an email at pitchingdoc@msn.com. Thank you.